name is Desmond Brown. I'm a resident in neurosurgery at Mayo Clinic in Rochester, Minnesota.
My name is Ian Parney, and I am a professor of neurosurgery at Mayo Clinic in Rochester, Minnesota.
Today we'll be discussing our paper titled Cranial Tumor Surgical Outcomes at a High-Volume Academic Referral Center, which will be soon appearing in Mayo Clinic Proceedings.
Our objective in this paper was to assess the rates of adverse events in adults undergoing surgery for cranial tumors at a high-volume quaternary academic center and assess the impact of resident participation on surgical outcomes.
Several prior publications have suggested that increased case volume per surgeon or institution is associated with better surgical outcomes for many procedures, including cranial tumors. However, increased case volume in many of these reports was modest, on the order of 10 to 24 cases per year per institution.
We felt that it was an open question whether these results could be extrapolated to a center with much larger case volumes. It was conceivable that outcomes could be worse at a very high volume center due to a mismatch between caseload, surgeons, and resources.
We were particularly interested in the impact of resident participation on surgical outcomes, as resident participation is something that can facilitate high surgical volumes.
In this study, we used a prospectively curated departmental database to review all patients undergoing neurosurgical procedures at our hospital from January 2009 to December 2013. A total of 6,277 neurosurgical procedures for intracranial neoplasms were identified. After excluding patients under 18 years of age, those undergoing radiosurgery alone, or those who had not provided research consent, we identified 4,423 neurosurgeries for cranial tumors that had been performed in 4,153 patients. These included 567 biopsies, 1,380 craniotomies for extraaxial or skull-based tumors, 1,326 craniotomies for intraaxial tumors, and 1,150 transsphenoidal procedures or craniotomies for pituitary or other paracellular tumors.
Overall, complication rates were low. Approximately 10% of patients experienced some form of neurological complication, of which 6.4% were temporary and or minor, and 3% major. Only 1.4% experienced wound complications, and 1.7% experienced medical complications. Mortality within 30 days of surgery was exceedingly rare and occurred in only 14 patients, or 0.3%. These outcomes compare very favorably to prior reports in the literature where neurological complications have occurred in 10 to 20% of patients, and 30-day mortality has typically been 1 to 2%. Moreover, resident education did not have any sort of negative impact on surgical outcomes. Resident participation was nearly universal in the 4,423 procedures reviewed. Even in cases managed semi-autonomously by our chief residents with consultant neurosurgeon supervision intraoperatively, there was no significant impact on outcomes.
Thus, we conclude that surgical outcomes for brain tumor procedures can be excellent at an extremely high-volume quaternary academic referral center with heavy commitment to resident education. Our outcomes are among the best yet reported for cranial tumor surgery and may serve as a benchmark going forward. Although it was beyond the scope of this study to determine if these results from our single institution can be extrapolated to other very high-volume centers, this seems likely.
Finally, our study adds to the increasing evidence that higher case volumes are associated with better patient outcome for cranial tumor surgery. Patients and physicians may wish to consider this when choosing a neurosurgeon. Future studies will correlate our institutional findings with those from national databases and will use our existing institutional database and electronic medical record to delve deeper into determinants of outcome for specific surgical procedures and cranial tumors.
Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.